Do you have an interest in science? Do you want your work to be interesting, exciting, and ever-changing? Consider a career in medical laboratory science where you get to run life-saving laboratory tests to aid doctors in the diagnosis of patients. The Medical Laboratory Technician, or MLT, requires a 2-year associate's degree, and the Medical Laboratory Scientist, or MLS, requires a bachelor's degree plus certification. The MLT and MLS share many overlapping duties and responsibilities. However, the MLS degree opens the door to management positions and some specialty labs. The laboratory career offers you stability and flexibility with shift availability 24 hours a day and 7 days a week. Working in the laboratory will keep you learning. Some laboratorians begin their career in phlebotomy or specimen processing, utilizing the hospital's tuition reimbursement, if offered, to continue their education. The whole lab testing process begins with a phlebotomist collecting a blood specimen. The phlebotomist obtains blood from an arm vein or finger stick on most patients, or through a heel poke on babies under 4 months. Each test requires specific tubes with chemicals called anticoagulants that prevent the sample from forming a clot, so the samples can safely run through the laboratory analyzers. The laboratory has many instruments that the scientists use to perform testing. These instruments have many moving parts: probes, cups, reagents, to name a few. The instruments can test for things like complete blood cell counts, glucose, cholesterol, antibiotics, drugs of abuse, hormones, and many other substances. All of these results are used in the treatment of patients. The doctors, nurses, and other team members evaluate the results and use the information for the patient's treatment, how much medicine to give, disease discovery, and emergency trauma care. The hemoglobin count included in the CBC complete blood count can alert us if a patient is anemic and may need a blood transfusion. This is where the blood bank comes in. Scientists in the blood bank receive blood products from the American Red Cross and have to be extremely diligent and make sure the products are safe for transfusion. Type and antibody screens are performed on every patient that needs products. This will tell us what blood type they are and what type of donor product they can receive. The microbiology laboratory is able to culture infectious bacteria and viruses, collectively known as germs, so doctors can prescribe the correct antibiotics and treatments to their patients. Medical laboratory scientists also have the opportunity to work in advanced specialty labs, some of which require the bachelor's degree route. Cytogenetics and molecular diagnostic labs run genetic tests on patients to diagnose hereditary disease and cancers, while histology labs analyze cells from surgical tissue for diagnostic reasons. Cytogenetics scientists are trained to recognize the structural changes in human chromosomes that cause disease and blood cancers, such as leukemia. A fun fact about the molecular diagnostic lab is that they also test for infectious diseases using the pathogen-specific DNA or RNA, such as COVID-19. There are many opportunities to explore with a degree in either medical laboratory technology or medical laboratory science. Consider making laboratory science your career.